If your pet is unwell, has some tests run, and your vet reaches a diagnosis, you'd have thought that you could trust its accuracy. But one common dog disease is misdiagnosed 50% of the time. And that's probably just the tip of the iceberg. Welcome along, I'm Dr. Alex. I've been a vet since 2006. And in this video, I want to help you make sure that your dog or cat never suffers a misdiagnosis that could not only compromise their health, but also cost you thousands of dollars in unnecessary treatment. And the first step to preventing a misdiagnosis for any disease, and I'll talk about the most commonly misdiagnosed diseases in just a minute, is to understand the issues surrounding test accuracy. Now, in an ideal world, we would want a test that could give a clear yes or no for every single condition that we're trying to diagnose. And we also would want every one of these tests to be perfect. And by this, I mean that every dog with disease that we're testing for comes back with a positive result, and every dog or cat without the disease comes back with a negative result. Unfortunately, though, we don't live in this ideal world. For many conditions, we're actually putting the results of multiple different tests together to reach a specific diagnosis, kind of putting a jigsaw puzzle together. And for those tests that are more targeted, we're actually dealing with imperfect tests. Sensitivity and specificity are two important measures of any diagnostic test's accuracy. They help us to understand how well a test can correctly identify both those dogs and cats that do and don't have the disease being tested for. So sensitivity, that refers to a test's ability to correctly identify individuals who have the disease. A highly sensitive test means that there are few false negative results, and so fewer cases of disease that are missed. For example, if a test for a certain type of cancer has a sensitivity of 95%, it means that 95 out of every 100 individuals who actually have the cancer, represented by the red dots, will test positive for it. This also means that 5% of dogs with cancer will test negative. Specificity then refers to a test's ability to correctly identify individuals who do not have the disease. A highly specific test means that there are few false positive results. So, for example, if the same cancer test has a specificity of 90%, it means that 9 out of every 10 dogs who do not have the cancer, represented by the blue dots, will test negative for it. Conversely, 1 out of 10 dogs who do not have cancer will actually test positive. So ideally, a diagnostic test would be both highly sensitive and highly specific. I mean, ideally 100% sensitive and 100% specific. But in reality, there is often a trade-off between the two. So a test that is very sensitive will often have a lower specificity, meaning that it may produce more false positive results. So that is a larger number of dogs that test positive do not actually have the disease, but those that test negative are likely to be identified correctly. On the other hand, a test that is very specific may have a lower sensitivity, meaning that it may miss some cases of the disease. In other words, a large number of dogs that do have the disease actually test negative with the disease, incorrectly saying the disease is not present. But those that test positive are likely to be accurately identified. So this test inaccuracy is one of the big causes of misdiagnosis, but it's certainly not the only one. Other factors that can result in misdiagnosis include actually just running inappropriate tests. So often when the symptoms of the disease being looked for are lacking, or something more obvious and common is missed out. The next is a lack of funds or local test availability to investigate more fully. So a test suggests a certain problem is present, but follow-up testing to confirm the diagnosis is not possible for whatever reason. Incorrect interpretation of history, or just not asking the right information, is the next reason for misdiagnosis. So clinical history is really an absolutely vital part of putting together this jigsaw puzzle of diagnosis. And if it's not accurate, it can very easily throw a vet off the right scent. Absolutely, the vet needs to be asking the right questions as well. But here I'm thinking about appetite, thirst, toileting habits and character, energy levels, and so much more. And then a lack of knowledge, especially of more uncommon diseases, is another obvious cause of misdiagnosis. So medical knowledge is growing at a really rapid rate of knots, and it can be a real challenge. I know this personally, to keep up with all the latest developments in vet medicine. being specific disease knowledge or new test availability. So with that all said, it's easy to hear this list and put the blame on the vet for making a misdiagnosis, but medical cases, they are very often not as simple as they sound on paper. Individual animals, I often say this, they actually don't behave as the textbooks say they should. And there are also very often limits on how many tests can be run or how complete and accurate a history is. With all that being said, here is my list of the 5 most commonly misdiagnosed dog diseases out there. At number 5, we have skin disease. So skin allergies are really common in dogs. And while they're often diagnosed with as much accuracy as can be hoped for, and very often we're talking about a diagnosis of exclusion, ruling out other things first, it's not without challenge and nuance. And one of the big diagnostic errors with these cases is a failure to diagnose a secondary bacterial or fungal skin infection. These are very common when a dog is suffering a flare from a long-term untreated skin disease, and actually failing to make this diagnosis can lead to the treatment with more and more anti-allergy medication, starting different costly supplements and various other treatments, when actually some form of antibacterial or antifungal treatment, perhaps just a simple medicated shampoo, is actually all that is needed. Heart failure is next at number 4. This one is a little bit more grey in the sense that over the last decade or so, it's actually been shown to be beneficial to start treatment for dogs with structural heart disease before they go into actual heart failure proper. It used to be that we didn't think that that was the case. Treatment is then ramped up with additional treatments as the disease progresses, as heart failure develops, and it is a progressive disease. It is, though, very easy to start a dog with a murmur, for example, on all of the late stage drugs at the early stage, misdiagnosing the level of disease actually present. And clearly a discussion also needs to be had if a medication is being started early, as for some this will end up spending so much money that by the time the disease actually progresses, there is nothing left in the kitty to further adjust treatment. And one huge negative impact I see with the misdiagnosis of overt heart failure is that an owner may elect not to treat a condition requiring anaesthesia. Severe dental disease causing chronic pain is the most common one here, because they feel the risk is too great, when in fact they have a murmur only and the heart is otherwise functioning well, making any increase in risk fairly negligible. The next misdiagnosis is different in the sense that it's actually a failure to make a diagnosis of chronic disease that would benefit from long-term treatment. So cases of mild lameness, especially in our younger dogs, they're very frequently passed off as just knocks, bumps and bruises, when in fact we know that around 40% of dogs under the age of 4 have arthritic changes in one joint that can be seen on X-ray, and 24% show signs of pain associated with this disease. But how many young dogs are we actually X-raying when they become lame? How many are given short-term anti-inflammatory painkillers rather than started on a holistic, multimodal treatment plan? Not very many. Next, and the second most commonly misdiagnosed dog disease, we have Cushing's disease, or hyperadrenocorticism to give it its proper name. So this is a hormonal disorder caused by an overproduction of the stress hormone cortisol, and it leads to symptoms such as an increased thirst, more frequent urination, excessive appetite, panting, pot-bellied appearance, thinning of the skin, and hair loss as well. And one recent study, actually involving a survey of over 2,000 vets from 9 countries, revealed that 60% of vets will conduct testing for this disease even when the dog is not showing clear clinical signs of suffering from it. And this is very significant because the tests for Cushing's disease are actually not that fantastic. In terms of sensitivity, so again, the proportion of dogs with the disease that test positive, the sensitivity for one test, the ACTH stimulation test, is only 60 to 80%. The other test, the low-dose dexamethasone suppression test, they're all a bit of a mouthful, is much better, around 95%. So most dogs with the disease will test positive, but its specificity is really low, with about 56% of dogs, so half of dogs with non-adrenal illness, so with not with Cushing's disease, falsely testing as positive. With the ACTH stimulation test, this figure is 14%. So it's better, but it's still not fantastic. And while this study didn't suggest just how many dogs were diagnosed or were misdiagnosed, the figure is likely significant, especially when a dog isn't actually showing the normal symptoms associated with this disease, which makes what we call the positive predictive value of these tests even worse. And then we've got the most commonly misdiagnosed dog disease, at least in my opinion. And at number one, we have hypothyroidism. So hypothyroidism in dogs is a condition where the thyroid gland, it doesn't produce enough thyroid hormone. And that leads to slowing down of metabolism and various health issues such as weight gain, lethargy, and skin problems. The challenge with diagnosing an underactive thyroid in dogs is that any other disease in the body can also naturally reduce the amount of thyroid hormone being produced. This is something that we call euthyroid sick syndrome. And that's a normal protective response to severe illness or physiological stress because it helps the body to conserve energy by lowering its metabolic rate. So then how often is hypothyroidism misdiagnosed? Well, another recent study examined the accuracy of hypothyroidism diagnosis in dogs, and researchers looked at 102 dogs being treated for hypothyroidism. We had 3 veterinary specialists that reviewed the case notes for each of this dog. They reviewed the history, the clinical findings, the laboratory testing, and they came to the conclusion that between 45 and 59% of these dogs did not require treatment for underactive thyroid. In other words, about half of these dogs have been completely misdiagnosed. This finding suggests that not only should thyroid testing be done on dogs showing clear signs of the disease, but also that further testing is likely to be highly valuable in confirming this diagnosis. And with all of these misdiagnoses, the end result can be an unnecessary financial burden on you, the pet parent. It can include a potential reduction in the quality of life and actually deterioration in health of our pets, or just an increased risk of drug side effects. But if these are the most commonly misdiagnosed diseases, you actually need to know about the most common preventable conditions that I see every week in my consult room. And you can dive into those in this video linked on screen now. So tap on that video. I'll see you over there. But until the next time, I'm veterinarian Dr. Alex. This is Our Pets Health, because they're family.